Diabetic retinopathy. Now, diabetes is one of the most popular conditions that we all know. Almost every family, I think, among our elders, sometimes in children as well, that we see diabetes. Now, basically today, there are many effects that one would get with regards to the eyes because of diabetes. But then today, first of all, I would like to define what diabetic retinopathy is all about. Diabetic retinopathy, to understand that, you should understand what a retina is. So for that, very quickly I will take you back to the camera. A camera has a lens in the front to focus the image from outside and a film inside. So similarly, the eye also has a lens in the front and also a film in the back. So this lens within our own eye, while it focuses all the images that we see outside onto the film part in the eye, which is called the retina. So the film that you come across in a camera is what retina is in the eye. Now this retina is full of multiple blood vessels. It is like a tissue paper thickness, and it is full of microscopic, very tiny blood vessels. And then it receives the picture and transmits that picture through a nerve, like a wire, to the brain, so that we see the image. It's like developing in the dark room inside. So this retina, which is, like I said, very thin film like a tissue paper, full of blood vessels. The blood vessels basically get affected in diabetes. So obviously when there are a lot of blood vessels there, it gets affected and they leak. So a normal retina, very healthy retina, sees a very crisp and clear picture. But imagine that retina is now with leakage. What gets leaked? Sometimes little bit of blood, sometimes little serum, what we call exudates. So all in all, it is affecting that layer so that the image that drops onto the retina is no more clear. And if it is not taken care at this stage, slowly the retina gets deteriorated to the extent of going completely blind. So diabetic retinopathy, in simple terms, from what I just said, is nothing but the diabetes itself because of everyday lack of control, lack of discipline, no exercise, no diet control, all this. When I said lack of control, no proper medication. When it comes to medication in our country, we are blessed with 3 different medicines. We have allopathic medicine, we have Ayurvedic medicine, we have Unani medicine, we have homeopathy, 4 actually. So the confusing factor is when first the patient comes to allopathic doctors, we treat diabetes our scientific way, and a neighbor or relative will tell them to try homeopathy or Ayurvedic. I have nothing against neither homeopathy nor Ayurvedic nor Unani because I would try them on myself, no issues at all. But my advice is, please do try the other things, but don't discontinue what allopathic treatments that are given to you, because slowly the retina will deteriorate. So the preventive thing, what is that we can do to prevent diabetic retinopathy? The way to prevent diabetic retinopathy, because it's a silent killer of eyesight, silently it reduces. The patient will not know. By the time you get to know, it's too late. So the best way is to get your eyes examined if you are a diabetic every 6 months until you develop retinopathy. After you develop retinopathy, you should get your eyes checked every 4 months so that your retinologist, the doctor who is the eye doctor who is an expert in retina, will further treat you. Prevention is in your hands, which is regular eye examination. Every 6 months, if you do not have retinopathy and only have diabetes. Every 4 months if you have retinopathy. Now once the treatment started, your doctor will tell you how frequently to come, usually every 3 months. Now, very quickly to introduce you to the treatment aspects. First and foremost, we try lasers. And if the lasers do not work, usually 3 sittings of lasers are done. We also give nowadays injections inside the eye. Now supposing the lasers and the injections do not work, then you will end up in actual operation. So I would not like anybody to take this to the extent of surgery, but believe me, if surgery is done in time, again you retrieve your vision. So all in all, diabetic retinopathy is something that should be very aware about it. Everybody who has diabetes and who has family history of diabetes, even if one person in the family has diabetes, I would advise you to do what I just said. Thank you.